show you better results in less time for the same risk factor, obviously you want to encourage your patients to go there. So I'm bringing up the topic because I get lots of phone calls from men, proton beam or not, and these installations sometimes they cost $100 or $200 million.
Wow.
And if they cannot get these prostate patients, they probably will fail because there's not enough other cancers that need focal treatment, so to speak. And right now there's about 11 centers across America, and there's about 15 being built. And it's often being built by businessmen. And you can imagine if these insurance companies are stopping payment, what's going to happen to these centers. So it's a good thing. It's a good thing because if they can't prove their treatment is better, they really shouldn't be doing it.
Sure.
So I refer you all to this article in Wall Street Journal on Thursday. It was one of the lead articles. And one of the experts at Harvard, Dr. Chandra, said he was encouraged by the steps that insurers are taking, but he pushed that Medicare should stop paying for proton beam because of it, because it has not been shown to be superior. So it's interesting.
Yeah, for sure.
It's a very interesting story. We have Dr. Eisen on the line. Dr. Eisen is a colleague of mine who's dedicated his life to taking care of Spanish-speaking patients. Good morning, Dr. Eisen.
Good morning, Dr. Lederman.
You have to turn off the radio in the background, otherwise we're going to have...
there is no radio here. I don't know.
Something's going on.
Well, let's...
How you
we
doing
can hear you
today?
okay, Dr. Eisen. Go for it.
Can you hear me?
Yeah, I can hear you.
Why don't you call back? Why don't you call back with a new phone line, because we got a lot of feedback. If you would, sorry. So we'll hope to speak to Dr. Eisen, who's taking care of our Spanish-speaking patients. There's other news out there today, and some of the news is from patients, which I always try to learn from patients and pass on information about patient care. I had a man who came in today with kidney cancer. And it was an interesting man. He's worked for the city of New York for 35 years. And he wasn't feeling fine. He had abdominal pain and weakness, and they fired him in March. He lost his job. He lost his insurance.
Wow.
Terrible.
And then he went to the doctor. And when he went to the doctor, he had a cancer of the kidney and the adjacent tissues. I mean, Rob, you know the adjacent tissues. So it spread from the kidney to the arteries and veins of the kidney to the aorta, which is the main blood vessel from the heart, right?
From there it can go anywhere.
And it went to the inferior vena cava, and it went to the artery of the opposite kidney.
That's terrible.
So you can imagine how extensive this cancer is.
Sure.
And he's anemic, and he's got pain, and he's suffering, and he came to me, and doctors elsewhere were trying to talk to him about surgery. We can imagine his surgery of the kidney is involving both renal arteries, inferior vena cava, aorta, and he has a pleural effusion. So tell people what a pleural effusion is.
Yeah, so it's basically like a fluid in the pleural space, which is like around the lung.
And what do you think the cause of that is in someone who's got an advanced kidney cancer?
Well, it's associated with tumors as well.
Right, because often cancers spread to the pleura,
Right.
and there's a lot of fluid that the body makes. The pleura is the surface covering of the lung, and the body makes a lot of fluid and absorbs a lot of fluid. And often when the cancer cells get into that pleura, the body can't absorb the fluid anymore, so the fluid accumulates. So he's probably got metastatic disease to the pleura and this big mass. And I told him I think the likelihood of successful surgery is about the goose egg again.
Yeah.
I agree.
And it's a great case for radiosurgery, and so we're going to talk to him about doing radiosurgery on this. We usually do 5 treatments, and usually for kidney cancer, our success rate's about 90%.
That's
where
great.
we aim the beam to stop, shrink, or make the thing go away with time. We need to put a needle in that fluid and see if it's malignant or not.
Right.
And that's where we stand. But it's an interesting case that he worked so long for the city. Instead of going to the doctor first, he went to the employment office.
With the
and they fired
union or
him.
whatever his case may be.
So it's really sad. And often
Very
men
sad.
see doctors less than women. It's something, I don't know, in our genes that we don't like to see doctors.
It's
very
our
much.
stubbornness. Yeah, maybe that's what it is, guys.
It's something. Maybe it's maybe us men are a little bit stupid. Anyway, Dr. Eisen's back here, so hopefully we're going to get a good line. Good morning, Dr. Eisen. Buenos dias.
Buenos dias, Dr. Lederman.
Buenos
That's a lot
dias,
better.
doctor.
How are you today?
Very good. How are you?
Great. So I was telling our listeners that, Dr. Eisen, you have devoted your life to taking care of Spanish-speaking patients. You were born and educated in Argentina, and you trained in radiation at Columbia, so you have a 4-star education. And tell me what you do for your patients.
Well, one of the things that we are doing at your center right now is working with patients sometimes that they fail the treatments. And when they come to us, sometimes...
These are people that have treatments that fail elsewhere.
And what happened is that some of these patients, they come to us, and after a very long conversation, we are able to, in some of them, focus the radiation exactly in the area of recurrence. And amazingly, for the patients and for us, some of these patients are coming along very well. Recently,
What percent? Do you know the percent that do well after
well,
radiosurgery?
it all depends sometimes in the location of the tumor or the recurrence. And the beauty of radiosurgery is that we can actually put the radiation in the area and to minimize all the other structures around. So it's tedious sometimes. It's a long conversation. Our center has that capability. And the most important thing, that I can do the whole thing in Spanish. So that makes a huge difference.
¿Qué pasa?
Right, ¿qué pasó? And that makes a huge difference, because sometimes what makes the difference is really going again fresh to the whole situation again from scratch. And that's why I encourage some of my patients to come and take a look again. Just don't say that this is maybe this is just we're going into palliation. Let's look at the case again. And to my surprise, some of these patients are, and sometimes when I refer the patient back to the original physicians in very good centers, they call me back almost surprised that they say, wow, things are coming along. Well, now let's take a look. Maybe we will try a new type of chemo, or we will talk to the surgeon. So it's a second chance that, for me, actually, these days are making a huge difference.
Well,
by the way, I would like to leave the telephone number.
Before you do that, I just want to say to listeners, you're being a little bit modest, because actually the success with our treatment for patients with new or recurrent cancers, where we treat, so we're like a surgeon where we treat, is about 90%. So 90% of the time we can stop or shrink that cancer where we aim the beam. So we're better than baseball players. Ted Williams batted 400, and he was like the best, right? No one else batted 400.
Exactly.
Well, we're batting 900, and we do it every day, and we take on a lot of tough cases. So tell me, ¿qué número?
Well, okay, el número es, en español, 917-836-8105.
Encore.
917-836-8105. And in English, it's 917-836-8105. And you are absolutely right. I mean, in fact, recently I had a patient coming for a very good center with 2 lesions in the liver. They tried extremely hard for a long time on chemo. This patient had metastatic disease. And we gave him, because you also helped me 100%, we gave it radiosurgery. I just got the PET-CT last week, completely, we couldn't even find the lesion. The patient went back to his center, and they were calling me, they couldn't believe it. So I really encourage patients to, when the team, in whatever center they are thinking, well, maybe now we are moving just only into supportive care, come to us, let's take a look, let's go deep on the situation, and to my surprise, and many times the physicians, we can find a way around. So,
all right, thank you very much, Dr. Eisen. When can people call you? Are you available nights, weekends, and holidays?
I am available 24 hours, 7 days a week, and this number is direct to me.
Okay, fantastic.
Great, Dr. Eisen. Thank you so much.
Have a great holiday between your phone calls.
Bye-bye.
We're going to go to a sponsor. Our sponsor is fantastic, and our sponsor has a fantastic voice also. At Radiosurgery New York, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique.